The hardest questions doctors may face: who will be saved, who won't? As coronavirus infections explode in the U.S., hospitals could be forced to make harrowing choices if pushed to the brink. Planning is already underway. The medical director of the intensive care unit had to choose which patients' lives would be supported by ventilators and other equipment. Hospital officials asked her to decide which ones would get the life-saving resources. The French military leader's chief surgeon, Baron Dominique Jean Larry, concluded that medics should attend to the most dangerously wounded first, without regard to rank or distinction. For example, most called for reassigning a ventilator after several days if a patient was not improving, allowing it to be allocated to a different patient. Hospitals could assign ventilators on a first-come, first-served basis. Some thought that could disadvantage people who lived far from hospitals. Others argued for a more outcome-oriented approach. Health workers are urging efforts to suppress the outbreak and expand medical capacity so that rationing will be unnecessary. But if forced, they ask, how do they make the least terrible decision? How do they minimize deaths? Who even gets to decide, and how are their choices justified to the public? Medical providers are considering these questions based on what first occurred in China, where many sick patients were initially turned away from hospitals. And now is unfolding in Italy, where overwhelmed doctors are withholding ventilators from older, sicker adults so they can go to younger, healthier patients. Some commonly recommended rationing strategies, researchers found, could paradoxically increase the number of deaths. And protocols involve value judgments as much as medical ones, and have to take into account the public's trust. If hospitals withhold treatment by age, where do they draw the line? If they give lower priority to those with certain underlying health conditions, they may in effect be offering Black Americans less treatment than white Americans. If physicians try to redirect resources, putting a patient on a ventilator for a few days, then giving it to someone else who appears to have better prospects, more people may die because few would get adequate treatment. And if many patients have a similar chance of survival, what fair way is there to make a choice?